All right, guys, Chapter 7, Part 2. Now we're going to cover intelligence. So how do we measure our cognitive abilities? So we have several different methods. We have our achievement tests, which we tap into knowledge and skills acquired through experience, such as your formal education, just like this class. So your norm reference are compared to other students of the same grade. So all the fifth graders will take the same test because they are in that norm. They should have that kind of standard that is there. Criterion reference are compared against an established standard that's already actually set in place. We have aptitude tests, which predict probable performances in particular settings on a specific task, and your intelligence test. Your intelligence test is what you're going to be taking on Thursday. Now, this test that you're going to be taking is not a legit test. Your actual intelligence tests are several hundred questions, and it's in a very controlled setting. So normally you are monitored by someone that's going to watch you, make sure you're not going to cheat. It's really intense. How many of you have actually taken a real IQ test, not a fakey one? So Alfred Binet and Theodore Simon was the first people to develop an actual intelligence test. This assessed intellectual potentials of school children. So Binet and Simon's intelligence scale was based on the mental age. So based on the number of items a child got right, compared with average number right by children of various ages. All right, so this is our normal bell curve. So you're going to see bell curves throughout your education. You're going to see a lot in statistics. So your normal curve, when a large number of test scores are compiled, they are typically distributed in a normal bell-shaped curve. On this scale, the average or the mean IQ tests are 100. So with this one, your scores are typically between 85 to 115. This is your norm of your standard deviation right here. This is your normal test scores for your typical average individual. With your normal curve, it is bell-shaped. So majority of the scores clustered around the mean, so your average. Your IQ score assigned to the score of 100. So majority of test takers receive between 85 to 115. Now on your test, if you score below an 85, that doesn't mean that your intelligence is lacking. It just means that this is not a legit test. So we're actually testing different functions that you're not going to be tested overall. So I want you to go ahead and answer that in a question as well for your discussion post on Thursday. We have subnormal intelligence, which this is usually IQ below 70. So this is deficient aptitude functioning. We have a lot of brain injuries that may have caused this, chromosomal abnormalities, chemical deficiencies, and hazards present during prenatal development. So when your mom was pregnant with you, she may have ingested something, or maybe taken a drug, or were in an environment that wasn't healthy that could have caused issues for the developing brain. Your brain injuries, this can be you've been hit in the head several times, so a lot of concussions from football. This can actually cause your intelligence to dip a little bit down because we're affecting our brain at this point. Alcoholism, if you have severe alcoholism, our brain actually starts shriveling up like a raisin. So we have to make sure that we are treating our brain and our heads very carefully because that can actually cause a lot of problems. And there's other reasons that we have no control over, which is your chromosomal abnormalities. We have degrees of retardation, which we don't usually use the word retardation anymore. So our degrees are mild IQ, which is 55 to 70. This is usually your moderate is 40 to 54, your severe is 25 to 39, and your profound is less than 25. When I worked in the psych field, we would ask our clients, our patients, do you know what your IQ score is, or around about what your IQ score is? And if they come up and say, 67, then we usually cannot help that individual in a short-term facility. So our inpatient facilities are for your patients that are going through a certain episode or need treatment in order to stabilize them, in order to go out into their own little counseling centers. So at this point, we usually refer our patients to outside resources as long as they're not suicidal or homicidal. So for your IQ, in a paragraph, write if you think the IQ test is correct and true about yourself. If not, why? So I'm going to pull it up for you. You just have to pull up your PowerPoint, and it will come on. So you're going to enter your birth date and start your test. It's going to go over, let me give you my birthday so you know how old I am. Okay, so when you start test, you're going to go through each question like this. You do have a timer. Don't let this confuse you or make you super anxious. Take your time on these. So for this one, which one of the 5 is least likely than the other 4? So what do you think? These all have legs, so I'm assuming that the snake might be different. You're going to go down and proceed to the next question. So you're going to go through all of this. I'm going to show you the end result where you can get your, so this is going to say I have like an IQ of probably -20. Take your time on this. Actually focus. Almost there. Okay. So it's going to come here and it's going to calculate your score. No clue how I got to 74. So obviously, this is not super duper correct because I didn't answer anything besides question 1. So this is also another reason why I want you to add of why you think it's correct and why don't you think it's correct. Make sure you answer as to the best of your knowledge as possible in order to get the results that are closest to where you may be at. So for also with our intelligence, we have different types of intelligence. We have your artificial intelligence as well. So we always said that our computers or robots are going to take over the world. Well, they kind of already are. We use artificial intelligence on a daily basis and within the medical field itself. So if you think about it, when you have that person that takes your blood, it draws your blood out, have those little tubes. Do you think that they sit there and analyze your blood samples by hand on a little petri dish? Not any longer typically. They usually put it in a machine. This is your ANS. This is your artificial intelligence at this point, your neural networks. So this will be able to diagnose a certain disorder or disease within that blood result in order to help physicians work better or to solidify their responses with a thought. So this is artificial neural networks explained.
Every single computer on the planet operates through algorithms. Algorithms are mathematical recipes that instruct a computer to complete a certain task. Algorithms usually give a very, very specific set of instructions that leaves nothing to interpretation. What makes machine learning different from this old framework is that, in this case, algorithms can change their own instructions to improve the function of the computer. And this is really the core of artificial intelligence. While regular machines excel in speed and accuracy, they are limited by their program parameters. Human intelligence, on the other hand, is way more adaptable. So in order to truly achieve artificial intelligence, computers have to think adaptively. And there have been many approaches to make computers more competitive against the human brain. But some computer programmers concluded that, well, if you can't beat them, join them. One popular technique to generate artificial intelligence is in fact designed to work like the human brain and the nervous system. It's called artificial neural networks. So imagine that you stub your toe. There are sensory nerves in your foot that set off a chain reaction of signals that ultimately tells your brain that you just felt pain. And ideally, this is how neural networks should work. This program is comprised of a series of branching nodes that operate much like the neurons in your body. Computer programmers feed information to input nodes, which then transmits the information across the entire complex. This network then processes this information until it generates the desired output. So how does this network do that, though? Neural networks are inspired by 2 essential components of the human brain, the neuron and the synapse. A neuron is a type of cell that processes the information it receives from other neurons. The synapse is the connection between neurons, allowing information to flow from one neuron to another. These computer programs have their own version of each. In neural networks, the node acts like a neuron. It receives information, performs a quantitative function that transforms the information, then sends it away. A synapse then carries this information from one node to another, making its own adjustments to the data as well. When a node sends out a signal, its synapses modifies the information by multiplying the data by some constant value. This modifying step is called applying weight. A node can accumulate data from multiple synapse connections and adds up all this information together before processing it. Then, just like the synapses, the node makes adjustments to the data by multiplying it by a value. And this is called node bias. Our input data is subjected to weights and biases because this determines whether information is transmitted from one node to another. It acts like a checks and balances system. In order for one node to pass along data, it needs to be activated first. Nodes are activated when its output is big enough to pass a certain threshold determined by the computer programmer. If your data reaches past a certain point, it will move on to the next node. If not, the node remains dormant. This series of dormancy and activation, turning nodes on and off, is what determines the ultimate product of your network. And this is how networks tell the difference between pictures of cats and dogs, peanut butter and jelly, tomato and tomato. You get the idea. But what if this final product isn't what you wanted? What if your neural network accidentally claims a dog to be a cat? If the output leaves something to be desired, the neural network uses an algorithm called backpropagation to go back and adjust its weights and biases, fine-tuning its nodes and synapses little by little, until it gets a result that's closer to correct. And as it gets more data and feedback, the neural network gets more accurate. From this basic model, computer programmers can train neural networks to be better chess players, or to recognize voices, or to identify your doodles. This is a very simple model, though, as most neural networks contain thousands of neurons that form millions of connections. And yet, even the most sophisticated neural networks are still in the Stone Age compared to the human brain, that is close to 100 billion neurons. We've made big advances in artificial intelligence, but we need to be reminded every so often that we're still pretty far away from the real thing.
Okay, now the video I wanted to show you guys based off of your morphemes and phonemes. This one over here now. Very short video and then we were done. Well, that was super basic. I thought it was a different video than what I had. Okay, so for this, a phoneme can be the first part of a word. So, and child, or and the. Your morphemes are the actual words itself. So book, word, learn, reason. So when we start breaking this down for, first grades actually doing this right now and they're starting to learn how to read. So what was the one that my daughter was having problems with? Oh, insight. So for the first part, insight. It's kind of a big word. So I would cover up the sight word. So she would have just the I and an N. I said, McKenna, what is this? In. I said, correct. What's this word? Insight. And then she put it together. So this is your smallest part of your word at that point. Okay, you guys. I'm going to go ahead and post this over to your assignments. And I will see you next week. Have a good day.